And here I am by your side, Dr. Mel. Ride or die, as they would say. I don't want to use die. Ride or live. Ride or thrive. Come on, Dr. Mel. So nobody can hear. Nobody can hear in hearing land. So let me check. Yeah, there we go. Nope.
Microphone malfunction.
Yeah, there we are. We are on air now.
All right, fantastic.
And I'm
But
going
you get to see
the
me
behind the
do
scenes
some
things.
technical change.
Behind the scenes. And you're not they can't hear anything you're saying, Dr. Mel. And that's
Okay,
incredible.
keep talking.
And you're on delay, but it'll catch up. We hope to catch up.
All
Don't
right, all right,
don't
all right.
fiddle with it too much. Don't fiddle with it too much. Right there. And you
All
tell a doctor something and you wonder sometimes the doctor sound good now? Thank you. Thank you. They couldn't hear.
right.
Mm,
There you go. I went to medical school, not technical school, but
exactly.
I made it happen.
You made it happen. We're on
So
a
I
bit
was
of a delay.
saying that we normally have Lila Mays, but she had duty call, and so unfortunately, she can't join us tonight. But I see you were repping with a hat.
I am repping Lila. I'm here for Lila with the hat in support of the L busy, so busy. It's Lila.
Well, fantastic, fantastic. Well, we have an amazing show this afternoon, this evening. We have a deeply important conversation we are going to get into because we don't shy away from really important topics here on Excuse Me, Doctor. And today we're going to talk about pregnancy loss.
Yeah, that's right. We're going to talk about whether it's a miscarriage, a stillbirth, or a loss later in pregnancy. Sometimes the grief can be profound. Sometimes people never recover. People feel the pressure to stay silent or be strong without the supports that from the healthcare system. But we're here to
Absolutely.
correct that.
Yeah, we're going to talk about all of that. It's a really emotionally complex topic. Many people feel isolated during that time, but the truth is, pregnancy loss affects many, many, many people, and the rates of miscarriage and infant mortality are actually higher, disproportionately high in the Black community. Another reason why it's important to talk about it here on Excuse Me, Doctor.
Yeah, exactly. Today we have a very special guest. And I want to get this right because she is incredible and she'll share her professional work and her personal journey. Her name is Vedna Lacombe-Heywood, and she's a bereavement specialist and a trauma ICU nurse. So she's here to help people and she helps a lot of people get back on their healing path.
Absolutely. So make sure you stay tuned because she is amazing. But first, we're going to get into our weekly recap.
Here we go. We gotta we gotta get the intern to get us some
Oh
music
no,
for.
man, that intern.
I mean,
You got
I
work.
mean,
You got work with him some more. There we go.
they
Okay.
got a party. I don't know. Anyway, if you're watching, you know who you are, the intern. We need music next time. So,
So what's this
Dr.
first
Mel, keep it
topic?
moving to save a mind. Dr. Mel, listen, I just read a study that had me up in the morning, had me laced up in my Chuck Taylors immediately. They found out that physically active people, especially in midlife, which I hope I'm still in midlife, could cut the
I
risk
think so.
could cut the risk of dementia by 40% over 26 years. Is that true?
That is that is absolutely right. That this study showed that that's the case. And it's really important because there's no cure for dementia. So the best strategy is to not get it in the first place. This study showed that being physically active between the ages of 45 and 64 had the biggest impact. And even late life activity helped as well. it also dropped the risk by another 36 to 45%. So that's huge if you stay just basically stay physically active after 45.
Wow.
And our community especially needs to hear this loud and clear because we as African Americans are twice as likely to develop Alzheimer's and other dementias compared to white Americans. So when we find something this powerful and this doable, we have to shout it from the rooftops.
Yeah, that's the part. And it isn't like I'm going to run a marathon energy either. They looked at
Yeah.
moderate to heavy activity, brisk walking, dancing, biking, working in the yard. Not just I got to go get something from the kitchen.
Right.
It ain't
So,
that.
and that's because that moderate to heavy exercise or activity increases blood flow to the brain. So it decreases inflammation and it helps the brain stay flexible and resilient. And that's true even if you have the gene that raises your risk for Alzheimer's called the ApoE4 gene. So even if you have that, your genetics don't have to be your destiny. There's something that you can do to lower your risk.
Wow. So the takeaway from this family is move your body for your brain, for your future, for your family. A simple walk could be a clearer mind tomorrow. I think I'm going to run on that platform.
There you go.
I'm going to run on that. So look, the lung cancer screening wake up call, man. This so one when I read one study, it had me up lacing up my shoes, but this one really kind of blew my mind, Dr. Mel. Turns out that 1 in 5 people who should be getting screened for lung cancer are actually up to date.
Yeah, so that means that 4 and 5 are not, right? And this is a big problem because lung cancer is still the number one cancer killer in the United States. Black men have the highest lung cancer death rate in America, about 37%
Mhm.
higher than white men, and black women too die disproportionately from lung cancer. So low screening rates are costing families lives of their loved ones, especially in black families.
So who should be getting screened?
So it's all former and current smokers between the ages of 50 and 80, especially if you smoked or are still smoking for 20 years or more. You should be talking to your doctor about getting screened with a CAT scan or a CT scan of your lungs. If everybody eligible was screened, there would be 60,000 more lives saved. That's mind-boggling.
Wow. So with lung cancer, the earlier it's detected, the easier it is to treat, right?
Exactly. So the bottom line is we just have to make lung cancer screening a top national priority. People are dying who would be alive today if they had been screened because early detection saves lives.
Wow. So family, if you got somebody in your family, it could be you, not even in your family, that's in your
Yeah.
family. If you're between 50 and 80, currently smoking or you used to smoke, especially if you smoke for about 20 years or so, please contact your doctor. Please go in. Don't be a statistic. That's it.
Yes. And ask to be screened. Advocate for
Right.
yourself.
Right.
That's right.
Advocate. That's one of the things you do in your book. You preach advocacy, right?
Yes. Self advocacy and advocacy for those you love.
Yeah.
Absolutely.
So look, like the next one, I mean, I know our audience don't know, but back in the day I had long, luxurious hair.
It's still luxurious, just not long.
It's just not I don't want to raise the hat. Anyway, so the next one didn't apply to me because I actually had hair. And those of you who know me knew I had hair. So
Mhm.
look, I am not my hair, especially if it's synthetic. Dr. Mel, I got I got to pull something up on you. The peoples are talking. Consumer Reports for our young ladies especially has tested 10 popular synthetic hair braiding products. You know, the ones for braids, twists, protective style, edges, and all that stuff. Every single one has potentially dangerous chemicals. What's the deal?
Yeah, so the synthetic hair used in those styles, which is a key part of our culture. Um, and not the synthetic hair, but the styles.
Right.
It has things, chemicals like benzene, which is known to cause cancer. Other things called volatile organic compounds or VOCs that when you breathe them in can be irritating to the lung. And lead, which we know there is no safe level of lead, especially when you think about children's and teens getting their hair braided. So this could be a real problem, is a real problem.
Yeah, it seems to be. Look, I know some of these women and some of the kids, children wear these styles for weeks. I know, I grew up in a family with a hairstylist in it, and I know the salons, the braiding salons, are sometimes hot. They be dipping the ends of braids in water. Sometimes strike, using a flame or a match to make sure it's all complete. Um, and these young people could be inhaling these flames. So it looks like we should tell everybody about this.
Yeah, look, I wore braids for years. I mean,
Mhm.
years, and had many a ends dipped and many a ends set on fire with the flames, right? So I know I breathed in these toxic chemicals. So what we should be doing is looking at the labels, choosing non-toxic, lead-free, or hypoallergenic hair. You can try to soak the hair in apple cider vinegar, which can help to remove some of the surface level chemicals that might cause irritation. Limit how long you keep your braids in. And then if you notice scalp irritation or breathing issues or rashes after using synthetic hair, talk to your dermatologist or your healthcare provider and keep an eye out for safety recalls and safety alerts.
Yeah.
So until there's strong regulation in this industry, which there isn't right now, we really have to be smart, be vigilant.
Yeah. Bottom line is we got to protect the culture, our hair, and our health. They aren't separate. It's not a
Right.
separate thing. Safe hair is self love.
Absolutely. Absolutely.
I feel like a
Well,
DJ now.
yeah.
I feel like a DJ. Safe
Hey, that that
hairs.
that's hey, that's a potential T-shirt. We need to be
Come
looking for
on
that,
now.
on those Facebook ads.
Right.
Safe hair, safe love. We go
Right. Right. Right.
watch for it in a Facebook ad near you.
Coming to you.
Right. Well, thank you, Wayne. I'm gonna see you back, in a
Hey.
minute because we are gonna move on to our show. Today on Excuse Me, Doctor, we're opening a conversation that really touches the hearts of so many, but it's really rarely spoken about. And that's pregnancy loss, grief, and finding a path towards healing. So, in the US, over 20,000 babies are stillborn and countless more pregnancies end in miscarriage. And this often leaves families with grief that is unacknowledged and invisible. Our guest today is someone who knows this journey intimately. Vedna Lacombe-Heywood is a bereavement specialist, a registered trauma ICU nurse, and soon to be a psychiatric mental health nurse practitioner. She has spent decades supporting families through loss, helping them honor their grief, reclaim hope, and find resilience even in the darkest moments. So, Vedna, we are so honored to have you here with us today to share your wisdom and your guidance with our viewers. Thanks so much for being here.
Thank you for having me. Thank you.
Absolutely. Well, I want to sort of set the table for our viewers so they understand the depth of your clinical experience as well as your lived experience in your work in bereavement. Can you share with us your personal journey and how it shows up in the way that you support families with pregnancy loss?
Okay, thank you. Well, just in terms of my clinical experience, I have been a nurse working in trauma for over 20 years. In terms of my personal journey and how loss has shaped the way that I show up for grieving families, about 15 years ago, I experienced my first loss, and then 14 years, about a year later, experienced a second loss within my fifth and sixth month of pregnancy. Uh,
Wow.
for, for me, this personal experience has taught me that grief is both universal and deeply individual. Um, when I so through that loss, approached by someone, a social worker, and who asked if I wanted to work with families. I initially it stated no, I wasn't necessarily comfortable in doing so, and so this person kind of encouraged me and stated that my lived experience had value, and then also sent me to training. And so from there, I started working with families. And so for me, my personal journey allows me to kind of carry the memory of what it is, what it is to feel and sit in that same type of pain. It kind of grounds me and helps me to be present and humble in that experience. And it allows me to come into these spaces and not necessarily be there to fix anything, but just to witness and hold space for those families.
Thank you so much for sharing that. I mean, first of all, to have experienced that loss and those losses, and then to be able to transform them into connection with people in a way that you can engage and support them in the time when they need it most is amazing. And our producer flashed up on the screen that you're certified in thanatology. And I know our listeners are probably, and viewers are probably wondering, what does that mean? And how does it help you understand death, dying, and grief in a deeper way?
So, thanatology is the study of death, dying, loss, and bereavement. It looks at grief not from necessarily an emotional standpoint, but for more so like from a physical, spiritual, and cultural piece and social. Here in the U.S., we're a group of people mixed with different type of cultures and how we kind of not only experience certain situations, but how we experience, whether that is times of happiness and or times of sadness. And so thanatology looks at those pieces. Through thanatology, we learn that grief is not a disorder. It's a natural human response to losing someone that we love. So understanding that allows us to kind of support people in a way that reduces the stigma, honors their individual experience, and creates pathways towards healing.
Thank you so much for explaining that. I know that you've supported families after perinatal, meaning during the time of pregnancy, around the time of pregnancy, infant and toddler loss. I just have to share, as an emergency physician, one of the cases in my 20 plus year career that I remember the most is a 18-month-old that had climbed up on a couch that was up against the side of a window and fell down 2 stories. And the mom came running into the emergency department. They drove there holding her in her arms, and we worked on her for an hour. I just couldn't bring myself to stop. And yeah, I felt totally unequipped. The only thing is I spoke Spanish and they were Spanish speaking, and so that helped. But
Mm.
I felt unequipped to comfort them or offer words in that time. There was really nothing to say. What do you wish more people knew about this type of grief that often is invisible and misunderstood uh, with the loss of a infant or toddler?
Um, I wish that people understood that this type of grief is profound. It is lifelong, and like you mentioned, it's kind of as a silent grief. Parents, we call it almost like an arrested development.
Mm.
Parents don't. They know they not only grieve the child that they lost, they grieve their birthdays, they grieve their milestones, they grieve their futures.
Mm,
And so it's a disenfranchised grief in a sense. And so it's difficult sometimes, I guess, within society to kind of acknowledge that depth of loss, just because it's unimaginable.
mhm,
Um, and and so and then also, I guess, in terms of like this perinatal piece, I think it's a loss that, because people have not visualized the child themselves,
mm,
they haven't met the child, it doesn't appear real for some.
right.
But for the parents, for those families, the grief is real.
Of
And
course, of
so
course.
and so they deserve the same amount of compassion, and grace that you would give a bereaved family member that has lived
Right.
X amount of years.
You mentioned that thanatology, also takes into account culture. How does pregnancy loss uniquely affect Black women and Black birthing people, given the disparities that we see with, miscarriages, maternal health, and infant mortality in the Black community?
So, for Black women, I think at times the grief can be is layered, because you're not only dealing with the pain of the loss itself,
Mhm,
but the frustration, sometimes the trauma associated with like navigating the system. Many Black women have a tendency to internalize the
mhm,
grief, internalize the death, try to place blame on themselves. Um, and so it's hard for them to kind of find, like, I guess, dignity and agency within their healing. I know for myself, I had two experiences. One that with my first loss, um, was an experience where I did not have the support of healthcare workers that were
mhm,
handling my case. And so for me, I thought in that moment, had I not had my family, had I not had my friends, if I was a young Black woman in this room by myself, um, I
right.
think I think this type of loss would have broken me.
Yeah,
And then I had a separate experience where I was supported. I was very much supported in that. And so I think it's because Black women face disproportionate rates of pregnancy loss.
mm,
It becomes more of a layered type of
sure.
experience for them.
And, we're at the holidays, right?
Yes.
Oftentimes, I think grief and loss get magnified
Yes.
during this period of time. And simultaneously, as you said before, people internalize the grief, and there's almost a pressure to be strong and to move on. How do you help people give themselves permission to grieve without guilt? And what are, I guess is a two-part question
Mhm.
to grieve without guilt and also to get through trying specifically trying times like the holidays or milestone birthdays, etc.
So there's no like right way to grieve. I think i- in terms of giving yourself permission, allow yourself to feel what it is that you're feeling. Some of the times within our group sessions, we often talk about, I guess, sometimes like not necessarily, I guess, maybe some traditions that we, kind of build around like kind of this loss.
Mm,
We talk about um, having the ability to actually speak to family and friends about the loss, not having shame associated with it. We talk about this guilt. At times I've always framed guilt as saying, guilt was almost like the anchor. The anchor that doesn't allow people to move. And so how do we alleviate ourselves of that? Because especially as women, we always think, could there have been something else that I could have done in this moment? And so it's to kind of say to yourself that this was not of your own doing. And just for you to kind of just move through, attempt to move through your loss. The holidays are very, very difficult. I have had the honor of being around families who have created, especially, I would say, let's just say, use an example as Christmas, where they have set stockings for their lost child, where they've incorporated traditions for their kids to honor their lost child, if they have other children, family members, to honor their lost one. And so it's always making sure that their memory kind of stays alive. So yeah.
And by speaking about it, it allows people to express feelings that they have around it, so they're not keeping it all pent up. So to that, sort of along the same lines, what role would you say that ritual plays in the passing, in a miscarriage or a pregnancy loss? What role does ritual play in helping people move through that process?
Ritual creates structure. So we talk about how initially in those first few months, even for 6 months, a year, certainly in the first few months, you're almost, it's almost a haze. Because you're still going through this, the fact that you have lost something so near and dear, a person that's so near and dear to you. And so ritual creates structure in a time that appears kind of chaotic. That doesn't seem grounded, that doesn't seem rooted in anything. And then also ritual later on, almost it honors a life that existed, however brief. It allows, families to not hide. I can honestly say initially when I had my first loss, and I say that because I was working as a nurse in the ICU, and for me, death was something that I saw, quite often. And so sometimes as healthcare workers, we have a tendency to compartmentalize. And so that's what
I can vouch for that. Yep, absolutely.
Okay. So, and that's what I did with my grief. I put it in a box. And so for me, having the ability to create a ritual, to create some sort of tradition kind of bridged me with that loss. And so it made the loss real. It was something that I kind of kept to myself for a very long time until I understood, how this, affected me.
What are, aside from ritual, which sounds like it can be very powerful, what are some other grounding or coping tools that you teach to your patients? Especially, when things tip over into having physical symptoms like sleep problems, panic, physical pain. It can be very intense when you're grieving something. So, what are some of the techniques or tools that you offer to help?
I think, well, what helped me initially, I will say, is actually being amongst others who had actually lost. So, being part of a group of people who understand you. In terms of individualized uh, I guess tools, journaling helped,
Mhm.
writing, externalizing your thoughts. Um, Sleep is very, very important. So, like sleep hygiene, it is quite difficult, especially with a loss, because there is a tendency for people to actually, uh, i- in those last moments, actually replay those moments. Quite
Mhm.
often, because
Sure.
you're trying to uh, trying to find pathways to actually solve something that's unsolvable in a sense.
Yeah.
So,
And just to be clear,
mhm.
so that folks know what sleep hygiene is, the hour that you go to bed, not, no screen time beforehand, eating 3 and 4 hours, before you go to bed, having the room cool and dark, without a whole lot of noise so that you can maximize the quality of your sleep. That I'm assuming that's what you meant by sleep hygiene.
Yes, yes, yeah. Um, Therapy.
Yeah.
Therapy, individualized therapy, as well as the group therapy that I mentioned. Um, uh, I guess, attempting to find ways, there are different, so there's breath work, there's tapping, which kind of allows you to, kind of slow down, and just in terms of your response,
Mhm.
to that grief.
And
Um, there
that's literal
Go ahead.
tapping like this,
Yes,
right?
literal
I don't know
tapping.
all the points, but there's specific points that you can tap that help to calm your nervous system.
Yes,
Um,
yeah.
yeah,
So these are some of the ways, just, as, grounding tools.
fantastic. Um, so, your work is really about transforming pain into purpose. What does that transformation look like in real life? And how can somebody who's really stuck in the darkest part of grief begin that journey?
Okay. So I don't s so it doesn't it's hard. There's so many steps to that transformation, and that's some of the things that we've spoken about this evening. Part of the steps to the transformation, is seeking assistance and seeking help. But one thing I've had the opportunity to witness within group are those who have taken their pain, and they have, created, I guess, either organizations, they've dedicated work, in the honor of the children that they have lost.
Mm.
So whether it's engaging community work, supporting other families, this ritual system that we've talked about, um, that's how some have transformed this pain into purpose. I think for myself, um, I don't think I would be the person I am today had I not gone through this,
Mhm.
these losses. I was someone who was generally, I had no problem being behind the scenes. I wasn't an outspoken person, per se. And for me, the loss has transformed me in a way that, it has allowed me to not only advocate for myself, but advocate for others.
Mhm.
I have, become a community figure because of the loss. And then not only that, it's a way for me to honor them.
Mhm.
For me, the person I am today is because of the losses. It's a way
Right.
for me to honor, their spirit.
Yeah. Let me just say that that is just so beautiful because that had to have been a journey, a deep journey of transformation for yourself. And now that you can help so many other people. And there's one group of people that I don't want to leave out of this conversation. That's the partners of people who also,
Mm.
of the moms and the birthing individuals who also grieve, but it might be differently. What do partners typically struggle with, and how can they be supported as well?
So It ranges. This is quite varied. So a lot of times within our groups, um, women are accompanied by their partners. So that can vary. But then there are times where we have seen the partners come by themselves, and that could be.
Mhm.
I've seen partners come by as years later. Um,
Mhm.
they Partners have a tendency dependent, just based on gender and culturality and who they are in the society. They may feel pressure to be the strong person, or to kind of focus on like supporting the family as opposed to
Mhm.
um, you know their birthing partner. um, Sometimes their grief is they struggle with like this helplessness, as if they could not assist, their birthing partner in protecting either the partner and or the baby. And so for them, the grief looks a little bit different. And so it's allowing them to have permission to have their own story as it relates to grief. I know for my husband and I, we grieved quite differently. And for a long time, I didn't understand, what that was for him. And so, having the ability to talk about it, to kind of work through it,
Mhm.
helps as well. Grief or loss, especially in a marriage, can be devastating.
Yeah.
And
It can lead
so
to breakups.
it can lead to breakup. It can
Yeah.
absolutely lead to breakup. There are statistics that show that there is a large percentage of people who do not make it, in terms of their relationship,
Mhm.
because of loss.
Yeah, absolutely. Well, look, I would love to get into more questions, but I know that we have the audience, and I know that they
Okay, great.
probably have some questions waiting to be asked or some comments that are in the chat. So, Wayne, what are you seeing? What can you share with us? What's out there?
Wow. You know, this is incredible issue. And I'm so glad that you guys brought up the partners because um, uh, I I've gone through that pain of
Sorry.
yeah of losing a child uh, and it never leaves you.
No.
So it's not just the person. It's just not the mother's pain. So, and
Right.
then I watched my mother later. I mean, had watched my mother earlier lose two of her children uh, when before she went, and it was a whole thing of not burying her kids before she passed. But I want to thank you for your work that you
Thank
do.
you.
Right?
Mhm.
I mean, it is necessary, and really, everybody thanks you. Everybody thanks you.
Thank you.
So, questions. We have a question. How can, for families who feel, this comes from April, for
Mhm.
families who feel dismissed or unsupported in hospital settings, what advice do you give them for advocating for their needs?
For families who feel so, the advice I give them, is to advocate for their needs, is to speak up, if you have the ability to do so within that time period of grief. Sometimes it may not happen in that moment, but if it's something that does stay with you, to actually speak up about it. I can honestly say, with my first loss, I had an it just wasn't a favorable scenario, and it was something I kept with me for a very long time. I would say up to a year after that loss, and I thought to myself, why am I protecting someone that didn't protect me in that moment? And
Mm,
so
Mhm.
because of that, I was verbal about it. I ended up calling the hospital, and I remembered everything about it. Called the hospital and spoke to them about it, and eventually was able to speak to someone that was close to that person. So it's to advocate for yourself, to actually speak up, because you are not only speaking up for yourself, you're going to be speaking up for others who will unfortunately eventually go through the same, or may not have to go through the same
Right.
experience you did.
And I think that's therapeutic too, to know
Absolutely.
that what you experienced is something that you can help prevent somebody else from having to go through. I think that also helps. And you gave me some specifics when we talked. You mentioned, for example, in a OBGYN office, when you're there for your follow-up visit, you're there with a bunch of other women who are pregnant, right? In the
Yes, yeah.
waiting room. So maybe talk a little bit about like how you suggest setting things up differently so that it's more geared towards the needs of a woman who's going through pregnancy loss who has to have follow-up appointments.
So I think when making that appointment, just to mention, we can never make assumptions that the person on the other side of that call has a full understanding of that impact in terms of the loss. So just to say that, I am going to be coming into the office X, Y, and Z day. Is there a possibility that I will not be in the waiting room with other women who are pregnant? Is there a possibility that you could place me in like in a separate area, just so that I am not kind of rehashing some of that grief, like in a public setting. I can honestly say, with my first loss, that is what happened. I was in a waiting room with other women, and by the time I got into my to my appointment, I was in tears. I was in
Mhm.
tears because I was rehashing this. So my husband and I advocated for ourselves. And so the next time it did happen, I was placed in a separate area. Also, too, sometimes in these post OB appointments as well, just in celebration of life, you're going to see photos of kids and babies that are born. But for someone who is lost, that's a very difficult thing to be looking at as you're waiting for someone to see you. So we did also ask, if we could be placed in just a separate area, and it
Great
was,
advice.
yeah,
Yeah.
yes.
So we have a question from Doris Cara at Doris Cara. What kind of support can family offer without being insensitive to pregnancy loss?
I think that the type of support is, I guess, to be one to acknowledge the loss, to ask the loved one, um, what what can we do for you in this
Mhm,
moment? To understand that the loss is not a temporary thing, that it's something that the person lives with lifelong. A lot of times when someone suffers a loss, more often than not, a lot of people are there in those early moments, but
mhm,
it's when that person is now, when those few weeks and months where people now have left, and people are, kind of left alone with the loss.
mhm,
Those are the times when it's kind of needed the most. To know that there will be time periods that trigger people. Those are your lost dates, holidays, the your child's birthday, and so to be supportive around those times as well. Uh,
And I also wonder too, sometimes when it's specifically family, you
mhm,
know, in some cultures, there's a pressure for a couple to have babies, right? There's the
mhm,
expectation from the grandparents and all
yes.
that. So too, just sort of being cognizant if you're a family member to try to mitigate that and just be with the person where they are as opposed to looking forward to the future or continuing to voice those expectations.
Absolutely. And then also too, not creating this kind of blanket rationale for the loss. A lot of times, some of the things, and I know that's more cultural and or belief based. This wasn't your time. Those are those words. I For a lot of us, um, uh, create like almost like secondary traumas in a way.
Mm.
So, yeah.
Okay. So a comment from Valerie Spalding Parker. I worked in the surgical unit, and when there was a pregnancy loss, we moved the moms out of the OB unit to the surgical unit. So
Hmm.
Mhm.
she's
That's smart.
a friend of the show. And so we have another one from Yvette Montag, and she asks for the viewers who are watching today, who are grieving, whether a loved one, a pregnancy loss, or relationship, or even life transition, what is the one hopeful first step they could take? What's the one step they can take towards healing? What's the first one?
Oh, what's the first one? I think having grace for yourself. Having the ability to feel what it is you're feeling, and not to stuff down that emotion. Giving yourself space, I think, is one of those, working your way towards healing. Um, Sometimes, Dr. Mal, you talked about, sometimes we want to be strong, for others, for ourselves. Um, but at times that works against you,
Mhm.
because your body does not forget that. Your brain does not forget what has
Mhm,
happened, and it will show up somehow, some way, somewhere. And
Mm.
so it's having the ability to actually feel, so that allows you to move through grief. When you feel what it is that you're feeling, you know that allows you, and just to give yourself space. I don't think we do that enough. I
mhm,
think, sometimes we're just so caught up in what it is we have to do, as it relates to life. But this, I think, I can honestly say for myself, grief allowed me to re-examine life in a way that I'd
Mm.
never seen it before. Grief transformed me. I say
Wow.
death
mm.
transforms life. And that's what it did for me. It transformed my life. And so, but I had to give it the space to do so.
Mhm. You are preaching up in
Wow.
here today.
Thank,
Wow. And it is.
thank you.
You must give it
Thank you.
you must give yourself grace first, right?
Yes.
Absolutely. Absolutely.
Yeah. I think that's a message that everybody needs to hear. Like give yourself the grace enough to know that you need to heal and you've gone through
Yes.
something.
Yes.
Yes.
Hmm.
Yeah.
Yeah. So go ahead. Go ahead. I don't want
Oh,
to.
I was going to say this too, just in terms of a healthcare setting. I had one bad experience, but I had another experience that worked itself in a different way. When I lost, so when I the first experience when I lost my son, when I lost my daughter,
Hmm.
I will never forget how the nurses in the medical community
Hmm.
treated treated me. I remember the physician walking into the room, and I don't think she even said her name. I don't think she even introduced herself.
Hmm.
The first things that came out of her mouth was, "You will have kids. You will have children." So this was a person that in a time that my husband and I felt hopeless,
Hmm.
she weaved hope. Okay, because
Hmm.
Mhm.
we had already said to ourselves, if this happens again, we're not doing this again. That's one.
Okay.
Two, when I was in a hospital setting, i remember um I remember my husband coming to hug me, and then I remember another set of arms, and I thought to myself, who else is here? And it was the nurse.
Oh, wow.
who was hugging both of us. So
Mhm.
these are the things when, you ask about like what can we do in those settings? And it's to show compassion.
Mhm.
Yeah.
It's to show compassion, and to understand what is happening in those moments. So I just wanted to kind of bring that up because I didn't want to. Though we did have these bad experiences. We also had wonderful ones as well.
And I think it just shows how powerful when you allow yourself to feel as opposed to compartmentalize as a health
Hmm.
professional, and you are there and you allow that empathy to come forth and express it, how profound it can be in that moment for somebody. And I think that sometimes as healthcare professionals we forget that. We think that we need to stay professional. It protects us and we think we're protecting the patient, but actually it's the opposite. It's breaking down that professionalism, breaking down those barriers, and really being heart to heart that really helps people navigate that moment. So thank you for sharing that.
You're welcome. And you're correct. I remember when this first happened to me, I kept it silent. No one knew about it.
Mhm.
That's how I felt. And then when the second time it happened to me, it was actually very public. I had my second loss. I was at work. My water broke.
Mm.
So everyone knew about it.
Mhm.
But that saved me because when I came back to work, the compassion that I felt amongst
Mhm.
my coworkers, the
Mhm.
stories that I heard of people stating their loss. And then, furthermore, when people experience loss around me, they had the opportunity to actually come to me to ask me to actually speak with their loved ones,
Mhm.
their friends. So, yeah, so as I said, it transformed.
Wow.
So yeah, for families, and this is a personal question, Dr. Mel, for families with other young children, how do you recommend that they start talking to their children uh,
Um,
about a pregnancy loss in an age appropriate way?
Great question. Vedna?
oh, for me, okay.
Mhm.
Yeah.
So just to be honest, I in some of our group settings, I heard
Mhm.
stories of once again how other parents kind of incorporated their children, especially if their children were witnessing the pregnancy,
Mhm.
were familiar with the child that's being lost. In my case, my losses preceded my son's birth. And so even though I was in these groups for a very long time, I didn't speak to my son about the loss, even though I we have a like an area or shelf where we kind of like honor and so there was one day where my husband and I had this conversation with my son, and to see, so my son always wanted siblings,
Oh, wow.
and to
Mhm.
see that change in his world,
Mhm.
for him to understand that he did have siblings, like siblings existed.
Mhm.
My son asked me the question, where are they? He goes, are I had my father passed some years before, and my son goes, are they in, with pop-up? And I said, yes, they are.
Wow.
And so this is so much so that when my son, months later, when they were doing a, who are you in
Mhm.
school, and do
Mhm.
you have siblings, my son actually incorporated his brother and sister that he lost. So it's like you try to protect, but it doesn't necessarily. It actually completed
Oh, wow.
him in a
Mhm.
way that he knows that he has siblings. They're just not with him, you
Mhm.
know, in this moment. So I think, to be honest,
Okay.
Yes. I think that's I would love to continue talking, but I think that is the place to wrap it up, because I think we can sort of summarize by saying community, empathy, and communication. And
Mhm.
yes.
self-communication, giving yourself the grace, right? I think that was so profound, and how to eventually transform the pain into purpose. I think those are all the things that we've touched on. Thank you so much, Vedna,
You're welcome.
for helping us walk through this really tough topic, but being able to see that there is light, even during grief. So thank you so much. Thank you so much, Wayne, for being the Ride and Thrive co-host. And remember, everyone, be wise, be well, and be health empowered. Thanks for joining.